Hi, this is Zach Kolsman with Apex 360, and I am here at the Vigilant Biosciences booth here at IDS 2015. I'm talking with Dr. John Comisi from Ithaca, New York, and John, you have some pretty exciting news on the product side of things and on the industry side of things. So what do you want to talk about first? The product, the industry?
Well, basically, what we have, Vigilant Biosciences, is a leading innovator on oral cancer and cancer identification and risk assessment. Here at IDS, we're showing what we will be providing to the EU and eventually to the States as far as an oral cancer risk assessment tool. The tool is very elegant, very easy to use, and it fits perfectly into the dental workplace flow of opportunity. We have, from a commercial aspect, created a partnership distribution alliance with a firm in Korea, where once we get CE mark, they will be distributing in Korea and eventually in Scandinavia as well, again, once CE mark occurs.
Right, and there was a $5 million committed purchase.
And that's huge for a product that hasn't even hit the market yet. So the science behind what Vigilant has done and the brilliant people behind the creation of this science is just incredible. Dr. Elizabeth Franzman is the scientist, the physician, surgeon that identified the CD44 protein that has been shown to be associated with a higher risk of oral cancer than any other marker out there. The sensitivity of our particular risk assessment kit is 88%. More importantly, the specificity is 95%, meaning that we have a very, very low false positive, which is always the biggest challenge. In every other mechanism that I've tried to use for oral cancer risk assessment, it's always been very subjective, and there's never really been any accurate sensitivity or specificity. False positives have always been one of the biggest challenges that we've always discussed, and how do we overcome that? For the very first time with OncAlert, we're going to be able to cut down the false positives significantly. Putting it into a large situation, out of 1,000 patients, maybe 2 will be positive for oral cancer, meaning that with a 95% specificity, both of those patients will be identified. The other 998 will be identified as healthy.
Right. And now, so I'm a patient, I come into the office. This is a really elegant product. How does it work from the patient point of view?
Very, very simple. The very cool part about it is that it fits perfectly into the typical hygiene workflow. The patient comes in, has a seat. They're given a tube of 5 milliliters of saline. They open up the saline, put it into their mouth, they swish with it for 5 seconds, gargle with it for 5 seconds, spit into the cup. After that, the testing device is placed into the cup and sits for 10 minutes. At the end of 10 minutes, if the CD44, the total protein, is present in the salivary solution, the marker is going to indicating a high-risk situation. During that time period, of course, the hygienist or the doctor is going to be able to do whatever procedural work that they're doing, so there's nothing broken down. They'll go through their caries risk assessment, they'll go through periodontal assessment, they'll do their typical head and neck bimanual palpation, which is the gold standard. Everything goes normal. At the end of the 10 minutes, if the test doesn't indicate anything, that's fine. Annually, we do a test with the patient. If there is a test that's indicating that there's a high risk, the patient is then counseled with the doctor to determine lifestyle risk changes that can occur. And then the patient is then reassessed with the point of care test in 1 to 3 months. And that's if there's no lesion present. If there's a lesion present, we recommend biopsy, because that's still the standard as to what's going on. So we need to look at that. Biopsy is the confirmation that we've always gotten. The interesting part, though, is if the test comes back the second time, the patient comes back the second time, and they're positive again, their risk assessment shows that they are at high risk again, then we can go ahead to the second test. This is a two-step system. The second confirmatory test is a lab assay, which identifies and works with the ELISA testing for the CD44 protein and the total protein in 2 separate tests. Those tests will then be able to quantify the risk of that patient, that the specialist, the oral surgeon, the ENT, or the head and neck surgeon will be able to identify the next steps in intervention for the patient. So this is going to really change how we look at early intervention for our patient. And it's accurate, it's exquisitely simple, and it's going to be very cost effective.
Yes, right. So we've seen a few products out on the market or trying to get to market. Cost is always the big issue. We talked off camera a little bit about, okay, is this going to work for a practice that has to be very considerate about where the patient's out-of-pocket expenses are going? It's a long introduction to a simple question. How much is it going to cost?
Well, currently, typically for many of the visible light tests that are out there, there's a cost of around $40 on average that I'm seeing around the country as I go around and lecture. Our hope is that when we release this, that the average retail cost will be between $25 and $35 to the patient for the point of care test. Very inexpensive, very accurate. We've never had this kind of accuracy in any other test prior to OncoAlert.
So what kind of response are you seeing here at IDS? I mean, obviously, people come here to get ideas about the new products and then take these out into the world.
Right.
What are people asking about?
The response has been huge. Because this is so unique, because there's nothing else quite like this available, the opportunity to intervene and the opportunity to assess risk earlier than we've ever been before has been immense. We've had people coming from all over the world to talk with us. How can they get this product into their country? How can they work with Vigilant Biosciences to distribute it into their neck of the world? And we're very excited because if we can help every place in the world find oral cancer risks earlier, the overall cost savings to healthcare will be billions upon billions of dollars worldwide. There are countries in which risk of oral cancer is so extraordinary. The Indian subcontinent is one of the ones that comes to mind right off the bat. Our understanding there is that they can't wait to get their hands on these assessment tools, and we're very happy to get that to them as soon as we finish our validation tests, which are almost done.
It's a great product to be talking about. April is Oral Cancer Awareness Month. Exciting timing. John, thanks for your time.
Thank you so much, Zach. I'm very glad to be here. Thank you all out there. Appreciate it.
Thank you.